people over 60 do something so ordinary they barely notice it. You stand up from the couch, carry groceries into the kitchen, climb the stairs, or lie awake for a second at night and suddenly feel it, that strange thump, flutter, pause, or hard little kick in your chest. Most people brush it off, blame coffee, stress, or getting older, and move on with their day. But what if that skipped beat is not a harmless quirk at all? What if your body is sounding an alarm about an electrical problem inside your heart that can quietly raise your risk of stroke, heart failure, blood clots, and a medical emergency that strikes without warning? And here is the part that should stop you cold. Some of the most dangerous rhythm problems after 60 cause no pain, no dramatic collapse, and sometimes almost no symptoms until serious damage has already begun. According to major public health organizations, atrial fibrillation can increase stroke risk about 5-fold, and many people do not even know they have it. Stay with me, because what seems small can become life-changing. I am Dr. Arthur Bennett, and I am going to show you exactly when a skipped beat is harmless, when it is urgent, and what you should do next to protect yourself. Do not ignore it. If your heart seems to skip, race, flutter, or pound after 60, the first thing you need to know is this: the sensation is real, but the meaning can vary dramatically. One skipped beat might come from a harmless extra beat. Another might be the first clue that the heart's electrical system is losing coordination. Picture this. You finish dinner, rinse your plate, reach up to put away a glass, and suddenly your chest gives a strange flip, followed by a pause and one heavy thump. You freeze. Was that anxiety? Indigestion? Too much coffee? Or something far more serious? This is exactly where many dangerous heart rhythm problems hide, because they often arrive in ordinary moments when you least expect them. According to Medline Plus and other major health institutions, an arrhythmia means the heart is beating too fast, too slow, or irregularly, because the electrical signals are no longer moving in the normal pattern. What happens inside your body at this point would surprise most people. Your heart is not just making a strange sensation. It may also be pumping less efficiently, which means your brain and other organs can receive less blood with each poorly timed beat. That can explain dizziness, weakness, shortness of breath, sweating, or a feeling that something is simply not right. But here is what most people never realize. After 60, a skipped beat is more likely to matter because age, high blood pressure, diabetes, sleep apnea, thyroid changes, and scarring in the heart can all make rhythm problems more likely. Medical experts have consistently warned that older adults are also more likely to have episodes with no obvious symptoms at all. That is why some people discover a rhythm disorder only after a fainting spell, a visit to the emergency room, or even a stroke. Now, not every skipped beat means disaster. Premature beats, including PVCs, are common and can feel dramatic even when they are not dangerous, especially in people without structural heart disease. But this is only half of the story. The part that truly matters is learning which sensations are merely annoying and which ones are your body's urgent warning signal. And what I am about to tell you next is where the real danger begins. One reason older viewers should take this seriously is that the same skipped beat can come from very different conditions. A harmless premature beat may feel huge because the pause afterward makes the next beat strike harder. But an irregular rhythm that keeps recycling can mean the heart is losing its normal sequence again and again. That repeated chaos can lower blood flow, stress the heart muscle, and leave you feeling strangely tired long before a diagnosis is made. So, if episodes are becoming more frequent, lasting longer, or showing up during simple chores like sweeping the floor or making the bed, that pattern alone deserves respect and a proper evaluation. That is why repetition matters far more than one isolated jolt. The condition that worries doctors most when people describe a skipped beat after 60 is not always the single extra beat itself. It is the possibility of an ongoing rhythm disorder, especially atrial fibrillation, often called AFib. According to the CDC, AFib is the most common type of treated arrhythmia. The risk rises with age, and millions of Americans are expected to be living with it in the coming decades. In fact, CDC materials estimate that 12.1 million people in the United States could have AFib by 2050. Now picture a quiet Saturday morning. You are making toast, pouring coffee, maybe feeding the dog, and your pulse feels uneven for a few minutes. Not fast enough to panic. Not painful enough to call 911. Just odd. This is how AFib can fool people. Instead of a dramatic movie scene, it often feels like fluttering, pounding, lightheadedness, unusual fatigue, or breathlessness that comes and goes. And this is where the stakes become very real. When the upper chambers of the heart quiver, instead of squeezing properly, blood can pool inside the heart. That stagnant blood is more likely to form clots. If a clot travels to the brain, it can cause a stroke. CDC information states that AFib is associated with about a 5-fold increased risk of ischemic stroke and contributes to about 1 in 7 strokes. That is not a minor nuisance. That is a major medical threat. Studies from major public health organizations also suggest that strokes linked to AFib tend to be more severe than many other strokes. But here is the shocking twist. Some people with AFib feel almost nothing at all. No crushing chest pain. No collapse, sometimes only a little flutter, a skipped beat, or a sense that the heart is not behaving normally. Others notice extreme tiredness and assume they are simply aging. This is why smart, calm attention matters so much. If you are having new, repeated, or worsening episodes, especially with chest pain, fainting, shortness of breath, or weakness on one side, that is not the time to wait and see. It is the time to seek urgent medical help. Yet AFib is not the only explanation, and there is another reason these sensations become more common as the years go by. Most people never hear about it, but it may be shaping what your heart does every single day. AFib can hide behind episodes. That word sounds small, but episodes can mean the rhythm. Slips out of order repeatedly, sometimes for minutes, sometimes for days. You may notice it while folding towels, checking the mail, or turning over in bed, then feel normal again by breakfast. That stop-and-start pattern is why people underestimate it. They think it passed, so it cannot be serious. But intermittent rhythm problems can still form clots, trigger falls, and strain the heart. That is why a symptom that comes and goes should never be dismissed simply because it does not stay all day. The hidden root cause nobody talks about enough is that many skipped beats after 60 are not caused by the heart alone. They are often triggered by everything surrounding the heart: dehydration, poor sleep, alcohol, certain cold medicines, thyroid shifts, anxiety surges, low potassium, sleep apnea, uncontrolled blood pressure, and years of wear that leave tiny areas of scarring in heart tissue. Think about an ordinary evening at home. You had salty takeout, a glass or two of wine, maybe an over-the-counter decongestant because your nose was stuffy, and you did not drink much water all day. Then you lie down, the room is quiet, and suddenly you notice every beat. The part nobody talks about is this. Some of those choices can change adrenaline levels, blood pressure, oxygen levels, and the electrical stability of the heart within hours. According to Mayo Clinic, extra beats such as premature ventricular contractions can be triggered by stimulants like caffeine or tobacco, alcohol, anxiety, exercise, certain medicines including decongestants and antihistamines, or disease that affects the heart muscle. NHLBI also notes that aging, scarring, high blood pressure, heart failure, diabetes, obesity, thyroid disease, lung disease, kidney disease, and sleep apnea can raise arrhythmia risk. In other words, your skipped beat may be your body's report card. It may be revealing a hidden condition that has been building quietly for years. What happens inside your chest at this point is like faulty wiring in an older house. Most of the time, the lights still come on, but under stress, the current flickers, sparks, or surges through the wrong path. That does not always mean the house is burning down. It does mean the system deserves respect. The good news is that this knowledge gives you power. If you identify the trigger, correct dehydration, review medicines, treat sleep apnea, manage blood pressure, or cut back alcohol, many people see real improvement. Doctors can also look for structural heart disease, valve problems, or electrolyte imbalances before they become more dangerous. So, before you assume a skipped beat is random, ask a better question. What is my body trying to tell me? Because once you understand the pattern behind these episodes, the next step becomes much clearer, and that next step can change everything. Another overlooked trigger is the way symptoms feel louder when the world gets quiet. During the day, noise, motion, and conversation mask subtle rhythm changes. But when you finally sit in your recliner, wash the dishes, and head to bed, every pause feels amplified. That does not mean you imagined it. It means awareness increases when distractions fade. This is also why keeping a simple pattern diary can help. Note the meal, the drink, the medicine, the stress, and the hour. When you bring that pattern to your clinician, hidden triggers that seemed random often become surprisingly obvious and much easier to correct. Even bedtime can magnify a flutter, making harmless sensations feel bigger and urgent to you in silence. So, how do you tell the difference between a brief nuisance and a warning sign that deserves immediate attention? Start with the pattern, the context, and the company the symptom keeps. A skipped beat that happens once in a while after stress or caffeine may be far less concerning than an irregular rhythm that keeps returning, lasts minutes or hours, or arrives with dizziness, shortness of breath, chest discomfort, fainting, or unusual fatigue. Picture yourself carrying laundry from the dryer, then suddenly needing to stop at the hallway wall because your heart feels erratic and your breathing changes. That combination matters. Medical experts pay much closer attention when skipped beats come with other symptoms because the heart may not be moving blood effectively in that moment. But here is what most people never realize. Even the timing of the episode can offer clues. If it shows up after alcohol, poor sleep, illness, or dehydration, those triggers may be part of the story. If it appears during light activity that never used to bother you, that can also be important. The practical next move is not panic. It is observation with purpose. Notice when it happens, how long it lasts, what you were doing, and whether you felt lightheaded, weak, sweaty, or short of breath. If you have a home blood pressure machine or wearable device that displays pulse rhythm, that information can be helpful, though it never replaces a medical evaluation. Health professionals now pay much closer attention to repeated palpitations in older adults because diagnosis is often simple once the rhythm is captured on an electrocardiogram, a Holter monitor, or an event monitor worn at home. Blood tests may also check thyroid function, electrolytes, anemia, or other hidden contributors. This is the relief many people need to hear. You do not have to guess forever. There are safe, common ways to investigate what is happening. And the sooner you do it, the more options you usually have. Early treatment may involve something as straightforward as reducing triggers or adjusting medicine. In other cases, it may mean controlling heart rate, restoring rhythm, or using blood thinners to prevent a stroke. The key is not to normalize a symptom simply because it is common. Common does not always mean safe. And once you understand that, you are ready for the most important part of all, the specific red flags and protective steps that can help you act wisely starting today. One more thing matters: frequency. A single odd beat every few weeks is a very different story from a pulse that feels uneven several times a day. If episodes wake you from sleep, interrupt meals, or force you to sit down while folding clothes, do not dismiss that simply because you can still talk through it. Subtle symptoms can still deserve quick evaluation, especially when they are becoming a new pattern. That simple record can help a clinician decide whether you need reassurance, testing, treatment, or emergency care the same day. First, know the emergency signs. If a skipped beat comes with chest pain, pressure, fainting, severe shortness of breath, sudden weakness, trouble speaking, or a feeling that you may pass out, do not drive yourself and do not wait for it to settle. Seek urgent medical care right away. Those combinations can signal a dangerous arrhythmia, a heart attack, or a stroke in progress. Now, for the everyday protection, most people can start immediately. Picture your morning routine. Before reaching for a second coffee on an empty stomach, ask yourself whether you drank water, slept well, and took your medicines correctly. That small pause matters more than people think. According to research summarized by leading health institutions, dehydration, alcohol, tobacco, poor sleep, stress hormones, and stimulant medications can all make extra beats more likely in some people. Blood pressure control matters too, because high blood pressure accounts for about 1 in 5 cases of AFib, according to CDC materials. If you are watching this and you regularly ignore skipped beats because they usually go away, I want you to write the number 1 in the comments below. You would be surprised how many people share that habit. But here is the important relief. Many people improve their symptoms by tightening up the basics. Reduce heavy alcohol use. Review over-the-counter cold medicines with a pharmacist or clinician. Ask whether sleep apnea could be part of the picture if you snore, wake tired, or stop breathing at night. Keep regular follow-ups for diabetes, thyroid disease, kidney disease, and heart health. If you have been told you have AFib, take stroke prevention seriously and follow the treatment plan your clinician recommends. That may include medicines to control rate or rhythm, procedures to restore normal rhythm, or blood thinners to reduce clot risk. None of that is meant to frighten you. It is meant to show you that action exists. A skipped beat is not always a catastrophe, but repeated patterns deserve respect, especially after 60, when the heart's wiring and the rest of the body are more likely to influence one another. Still, there is another group of warning signs people miss all the time because they do not feel dramatic in the chest at all. They show up somewhere else, and that is what makes them so dangerous. Another smart step is to check your pulse when symptoms happen. You do not need to become obsessive. You are simply looking for clues. Is it steady but strong? Fast and regular? Or uneven in a way that feels chaotic? That information can help your doctor decide what type of monitoring fits best. Keep a written list of all prescription pills, supplements, inhalers, and cold remedies too. Many people forget that medications for congestion, weight loss, or energy can push a sensitive heart in the wrong direction. And if the rhythm feels wildly irregular, instead of simply forceful, mention that exact detail because it can point more strongly toward AFib. One of the biggest mistakes people make is waiting for a heart rhythm problem to feel like obvious heart trouble. In real life, the warning can appear as exhaustion, reduced exercise tolerance, brain fog, poor sleep, or feeling winded while doing chores that used to be easy. Picture this. You are putting groceries away, and halfway through you have to sit down, not because of pain, but because something feels off. Your pulse is strange, your energy drops, and you tell yourself you are just having an old day. This is where the real danger begins. AFib and other arrhythmias can reduce how efficiently the heart fills and pumps, so the whole body may feel the effects before you ever get a dramatic chest sensation. According to major health organizations, untreated arrhythmias can contribute to heart failure, blood clots, stroke, and damage to the heart over time. Frequent PVCs can even weaken the heart muscle in some people, especially when there is underlying heart disease. What happens inside your body at that point is like running an engine with a mistimed spark. It still runs, but not smoothly, and the wear can add up. The reassuring part is that once the problem is identified, many treatments are highly effective. Some people need only trigger control and monitoring. Others benefit from medicines, treatment of sleep apnea, management of thyroid disease, or procedures such as cardioversion or ablation, depending on the rhythm involved. The key lesson is simple. Do not grade the seriousness of a skipped beat by drama alone. Grade it by repetition, associated symptoms, and whether your body is functioning differently than usual. If walking to the mailbox suddenly leaves you weak, if your pulse feels irregular for long stretches, or if your symptoms are becoming more frequent, that deserves medical attention. Bring a list of episodes, your medicines, and your questions. Ask specifically whether you need an EKG, longer rhythm monitoring, blood work, or an evaluation for stroke prevention. When you do that, you turn vague fear into clear information. And clear information is where real safety begins. Because the truth is, the goal is not to make you afraid of every flutter. The goal is to make sure you never ignore the one flutter that is trying to protect you. And that brings us to the most important message of all. This is why loved ones sometimes notice the problem before you do. They see you pause more often, avoid stairs, or give up walks you used to enjoy. If your family says you seem more tired or short of breath lately, listen carefully. Those changes can be valuable clues that the heart rhythm is affecting daily life, even between obvious episodes. And when you tell yourself it is just age, you may delay the simple tests that could reveal a treatable rhythm issue, medication reaction, or hidden condition like sleep apnea that has been stressing your heart night after night without your realizing it for years unnoticed. What you learned today is not that every skipped beat means danger. It is that your body can whisper before it screams, especially after 60, and those whispers deserve your attention. A flutter, a pause, an uneven pulse, unusual fatigue, breathlessness in the kitchen, or a strange pounding at night may be harmless, or it may be the earliest clue that your heart needs help. The good news is that you now know what many people do not. You know that extra beats can sometimes be benign, that atrial fibrillation becomes more common with age, that stroke risk can rise sharply when an irregular rhythm is ignored, and that triggers like dehydration, alcohol, poor sleep, thyroid problems, sleep apnea, and uncontrolled blood pressure can all play a role. More importantly, you know there is a path forward. Picture yourself tonight filling a glass of water, checking your medicines, and deciding that if this keeps happening, you will not brush it off again. That is not fear, that is wisdom. Maybe you are the kind of person who keeps going no matter what. You make breakfast, answer calls, take care of the house, and tell everyone else to worry less while you quietly minimize what you feel. But your health is not a burden, and paying attention now is one of the kindest things you can do for your future self. It is also a gift to your spouse, your children, your grandchildren, your friends, and the people who count on your voice at the table. The next time your heart feels strange while you are washing dishes or settling into bed, do not only hope it passes. Take a breath. Notice it. Respect it. And if it is becoming a pattern, let that be the moment you choose clarity over delay. You are not powerless here. A conversation with your clinician, the right monitor, and a few smart changes can protect years of life and peace of mind. I share this because I genuinely want you to be here, healthy, strong, clear-minded, and full of life, for the people who love you and for the moments you still deserve to enjoy. You do not need to panic over every flutter. You do need to respect what your body is telling you, and you deserve answers when something feels different. Small actions taken early can prevent much bigger consequences later, and that is worth remembering. If this helped you today, share it with someone you care about who always says it is probably nothing. And if you want more honest, simple guidance like this from me, Dr. Arthur Bennett, stay with us. We will keep walking through these warning signs together, one clear step at a time. Stay close, share this gently, and let this be the calm place you return to for honest guidance.